Hi there. I'll be talking today about Sculptra and the common questions that people ask me about Sculptra, the filler that stimulates collagen and enhances the volume of a region, the face or any other region that we can use it for. The first question people ask me is, what is Sculptra? Sculptra is a chemical that is made in the lab. It is PLLA, that is poly L lactic acid. It is polymer, synthetic, it is biodegradable, biocompatible, and usually non allergenic. The filler itself is used as an injection. It comes as a powder, and you mix it with saline or with water for injection. One vial, usually we put in about 5 cc of saline in, and shake it vigorously. And then that it is injected with 26 or 27 gauge needles. Sometimes I even use a cannula to inject it. Just make a little needle poke and take a thin cannula and inject it. That makes it a little less traumatic, and the chances of bleeding are much less with that. Is how does it work? Now, the PLLA itself is biodegradable. Once it goes into the body, it slowly degrades, and it itself does not act as a filler, but as something that stimulates filling. So what happens is when the PLLA is gone, the body starts building collagen around it. Once the collagen is built, then the volume of the area increases. So whether you use it for the face or some other part of the body, the the volume of that part is brought up through the body's own mechanisms of healing. Now, how long does it take to start seeing Sculptra? And the usual duration is 6 weeks or so. It can take a little longer or a little bit less. But what happens is initially when we inject it, there's a little swelling, and people think that there's some filling that has gone on. That's just the water, and the next 24 to 48 hours, that all disappears, and the volume is gone. But then slowly, the slowly and very gradually, the volume starts building up over the next several weeks. How long does it take us to do the procedure? Usually it takes us about half an hour or so to do it. I do put some anesthetic cream initially, and that takes another half an hour. So some people, they put the anesthetic cream before they come to us, and sometimes we put the cream and have them wait for about half an hour. The injections themselves are pretty quick, and after the injections we just do a little massage, and that there's no dressing, nothing else that is done, and the individual can go back home right away. Some people ask me, do they have to rest, and what are the post-operative follow-ups? If someone has to go somewhere, there are no follow-ups as such that are needed. But when you have had the procedure done, you should have that part slightly raised up. So if it's on the face, sleep with your face and head elevated a little bit. If it's on the buttocks on one side, you lie on one side. If it's on both sides, you kind of do the best you can, lie on your stomach. But for the first 24 hours or so, it is important to kind of keep the area where you've had the procedure done, to have it elevated. Not to do any heavy exercises for the first 24 hours. After that, you can be doing any exercises, weightlifting, whatever. But for the first 24 hours, just be careful not to do any heavy weights or rigorous exercise. Side effects and the risks. Now, the treatment itself is very safe. Occasionally, people may have a little bit of pain afterwards and itching, which usually goes away. Sometimes there can be some lumps formation, a little bit of bleeding inside, a little bit of bruising, and that all goes away. A rare complication is a granuloma formation. A granuloma is kind of like a hard knot that forms deep inside, and that is usually due to an unusual reaction, or or if the technique is not proper. If it is injected in the wrong place with the raw technique, then the chances of reaction becomes a little bit higher, and one can have a granuloma formation. That is something that would require some treatment to improve, and one will have to visit the injector again to make sure that that is taken care of. However, it is very unusual, and I have yet to see it in my practice. Now, how many treatments would you take? And depends on how much volume you want, and initially what collagen is built up, some of it is lost. So after every 2 or 3 months, you could have, or maybe even a month, you could have 2 or 3 treatments to get the adequate result. But very often, one treatment may suffice as well. Now, Another question that is often asked is, how about doing it for other parts of the body? And the answer is, it is an off-label use, but it can be used for the buttocks for buttock enhancement, especially for the dips. So where you have the small dips, you can fill those up. And another great use for it is cellulite, where you have little bumps of cellulite. Those can be tremendously improved by using Sculptra, and that is one of our trouble problems where most treatments do not help. But Sculptra will help you a lot with taking care of the little bumps that happen just beneath the skin, kind of the orange peel look. And one more thing, there is a somewhat longer lasting skin tightening that happens with Sculptra because of the collagen buildup again. And as I said, it is 6 weeks and sometimes can take up to 2 months or a little bit longer. But it doesn't happen right away. So some people find it an advantage because people don't notice it right away. And slowly it happens and it becomes something that people get used to in your looks as far as the face goes. Um, Now, the post treatment instructions, the most important instruction post treatment is keeping your part elevated, as I said. Then there's a rule of five, which means that you should massage the area for 5 minutes, 5 times a day for 5 days. So 5 minutes, 5 days, and 5 times a day. What are the differences between this filler and the other fillers? The main difference between this other fillers of hyaluronic acid are actual fillers. They just fill up the area with themselves. They don't stimulate any collagen or the body to do much. The body does take a little bit of water in the filler, and that increases the volume a tiny bit, from the what you've injected. For Restylane fillers or the Juvederm fillers, but with um, Sculptra, it is not an actual filler. It is a stimulator, a filler stimulator, if you wish. So it kind of stimulates the body to build in collagen, and then the effect happens over the next few weeks, and that part is built up for a while. The other difference is the longevity. Now, the longevity of most Juvederm or Restylane or other hyaluronic fillers is 1.5 years or so, sometimes 2 years. Now, Sculptra can last in excess of 2 years if good health is maintained and the body weight, etc., are maintained, and if one takes care of the area. So it can last for 2 years. It can last for even longer. Some people say it can last even for 5 years in certain areas for certain people. What about using other fillers with it? Usually, you don't use other fillers with Sculptra, but what you can use after a month or two is your own fat. So, what happens is that the fat itself has a little framework, and the Sculptra helps building the framework within the fat itself. So, it is of help. So, the effect of the two can be more than additive. So, if 1 plus 1 can be more than two. So, and some filling with Sculptra and then putting some fat in would give much more volume and much more structure and some tightening of the skin. Now, what are the contraindications? Well, the first, as like most things, is just having an allergy to any of the components of the injection, and your injector should study the exact components and ask you if you have allergy to any of those. Please don't use it. The second thing is, people who have bleeding tendencies are on blood thinners. They will have more bleeding, more bruising, and possibly even a hematoma, a collection of blood. So either come off the blood thinners or be very careful in injecting Sculptra. Actually, any other filler also, you have to be very careful injecting anything if you have a bleeding disorder. However, if it cannot be, if it is a minor break that you can take, you cannot take the full 7 days. What you can do is take less of a break and have your injector use a cannula. The cannula has kind of a blunt tip, so it goes in without cutting tissues in its path. You will have to have a little needle prick to introduce the cannula. But once the cannula is introduced, it is blunt. So when it goes in, it traverses the tissues. It does not cause any bruising or bleeding to any significant extent. So Sculptra, it's a great filler. It does not replace the other fillers, nor does it replace fat, but it is a great addition to what we have available for filling, and it gives a nice result if done well. Of course, if it is not done well, there can be issues, and one may get inadequate result. So discuss all these questions that you may have with your injector before you decide to go for this treatment. And if you have any other questions for us, please feel free to give us a call or contact us on one of these numbers given below. All the best.